Hello and welcome to Med Talks with Dr. Moin. Today we have a renowned cardiologist with us, Dr. A. Sreenivas Kumar. Dr. Sreenivas Kumar is a consultant cardiologist. He is a director cardiology and clinical research at Apollo Hospital, Jubilee Hills. Sir, thank you so much, sir, for visiting our facility.
Namaste. Thank you, Moin. Thanks for the opportunity.
I want to ask few questions to you about cardiology. I know that you are an interventional cardiologist, but for our viewers to know what is intervention, what is cardiology, I would begin like this. Sir, what is cardiology? What does it deal with it?
Good question. Basically, as you know, heart is on the left side of the chest in a fist-shaped organ, and it has 4 chambers in the heart, 2 on the above, 2 below, called atria and the ventricles.
Okay.
And the ventricles take blood from the right side to pulmonary artery to lungs, and it gets filtered and comes to left side of the heart, and from the left side to big vessel called aorta gets on to all the parts of the body. This is a normal anatomy and functioning of the heart. Sometimes, as you said, embryologically, when the heart is being formed, instead of being forming on the left side, some people very rarely have the heart on the right side. This is called as dextrocardia. And sometimes, instead of being on the right side, it can be the centrally located, just retrosternally. It is called as mesocardia. But let me tell you, mesocardia and dextrocardia are very rare conditions. But let all our viewers know that heart is on the slightly towards the left side of the chest. And as you said, it is a funny way. I would also like to tell you, heart, people say that he is a big-hearted person. So big heart is not necessarily a good thing, may not be very good in heart diseases, because heart, when it gets diseased and pumping becomes weak, size becomes increased. Actually, that is a bad sign for medicine. So good heart is not a big-sized heart, but a small heart functioning well is good heart from medical cardiology point of view. So I want you to understand this.
Yes, sir, it's an amazing thing. No matter big or small, you have to be good. So if the heart is big, you call it dilated cardiomyopathy. There is a disease in that. As sir has said, you have to be good. Your heart has to be good. So what are all the problems? Whether your heart is good or bad or it is in between, we don't know. Sir, what are all the problems you come across in cardiology?
Basically, as you know, heart has 4 chambers. And above the heart, you have a coronary arteries called blood vessels which supply the blood to the heart, and over which you also have a layer called pericardium. So if the diseases which affect the covering of the heart, they are pericardial diseases. The diseases which damage the myocardium, muscle of the heart, are myocardial diseases. And the disease which affects the valves inside or valvular heart diseases. So it could be any of these, but by and large what is commonly seen is a disease of the blood vessels of the heart. That is coronary artery disease. That is the atherosclerotic process where this cholesterol plaques, all the fibrosis gets deposited in the coronary arteries, and when the artery is occluded totally 100%, then only somebody suffers heart attack, which in medical terminology we call it as myocardial infarction. But before that itself, God is kind enough, warns people that cholesterols are developing, plaques are developing inside, and 70-80% when it is there, when the person walks, exerts, when the heart rate increases, then only he starts getting pain. That is called as angina. But if you further neglect, don't take care of your cholesterol plaques and maybe blood pressure, diabetes, the plaques could increase further, and then person could go to development of heart attacks, and then once a heart muscle gets damaged, that goes to heart failure. This is predominantly what we regularly see in middle-aged and elderly age people. Apart from it, if the valves inside get damaged, that is valvular heart disease. Those valves could be narrowed, which is called stenosis, or valves could leak itself, called regurgitation. So this is previously we used to see more commonly rheumatic heart disease in our country, where rheumatic heart disease happens because of bacterial infection, streptococcal infection, which actually comes through throat and involves the joints as well as the heart. But as the country is advancing, we do see less of rheumatic heart disease now. But valvular heart disease is another entity.
Okay.
Now, recently, many of you must have thought about COVID, and COVID sort of infections also sometimes could involve the heart muscle and make the pumping weak. That is what is called as myocarditis. So, that is another type of pumping function becoming weak, and then once the inflammation increases, then pumping decreases and patient goes to heart failure. Those are some of the types of diseases pertaining to heart itself. And as I said, from the heart you get the vasculature and the blood vessels, all the parts of the body. If they get narrowing, it is called as peripheral arterial disease. That also could lead to pain in the limbs, pain in the hands, and various other problems which are categorized as peripheral arterial disease. And the blood vessels which take to brain gets damaged, that is called as carotid arteries. Then inside narrowings, the patient could develop paralysis or strokes. So that is also nowadays is lot of increase is there even in that disease. And we need to take care and see the body as a whole and see that none of the blood vessels or the heart gets into damage by following all the lifestyle and precautions and if tablets if required if to be taken.
Sir, now there are two terms. Some people say heart attack and some people say heart failure. How different are these two?
Yeah, this is actually an important question which all listeners should know. As I mentioned, a heart attack is in medical terminology called as myocardial infarction. And heart has three blood vessels, one on the right side and the two on the left side. If the blockages develop in these blood vessels, like how do the blocks develop? Basically by accumulation of cholesterol plaques and some fibrosis, some platelets all getting inside and clotting happening in the blood vessels. And if the blood vessels totally get occluded 100%, then that part of the heart gets into trouble called as heart attack. So that is myocardial infarction. Immediately if a patient comes to hospital and if they open up the blood vessel, then probably we can again make the heart normal. But if you delay it, you think it is gas, many people don't come for treatment, then heart gets damaged. Once the heart gets damaged, like how if you get a injury, the scarring happens. The heart muscle also gets damaged, then the scarring of the muscle happens. So then patient will go into pumping of the heart gets affected then. Normal heart which can pump actively, once the scarring happens, it cannot pump. So that pump failure is in medical terminology is called as heart failure. Routinely, that is the commonest form of problems which we see in elderly people or patients who don't come to hospital in time after heart attacks and then they go into problem. That sort of thing is called as heart failure. So heart failure generally manifests as breathlessness or swelling in the feet or face. That's what generally people think as heart failure. The various types of it we can discuss later.
Can you please tell us the manifestations of myocardial infarction, that is heart attack?
Heart attack, actually, as I said, before going into somebody goes into severe form of chest pain, whenever the plaques are developing inside the blood vessels of the heart, so whenever a person is sitting, heart beats only 60 or 70 times per minute, then in spite of the plaques or the blocks in the arteries, still the blood supply comes. So that will be sufficient for the heart. But when he exerts, when he walks more, exercises more, heart beats faster. When the heart beats faster, then you need more blood, more oxygen, which won't be there, so a person gets discomfort. So that is called as angina in medical terminology. But as the plaques increase, you neglect it further, if the arteries get totally occluded, then patient starts getting pain even at rest, and the pain is the severest type of pain, which is actually in the retrosternal region, and it could radiate to arms and to the jaw, and it will be associated with sweating, and sometimes patients could get belching, which will be often confused as gas. So this sort of severest form of pain, it's actually if you have to rate pain from 1 to 10, the 10th number, most maximum pain is for labor pains, and the 9th number is for heart attack pain, that's severe nature. But it need not be confined to only one particular point. It will be diffused in the chest, and you may not be able to pinpoint correctly. And then that sort of severe pain associated with sweating, sometimes vomiting, is a sign for impending heart attack. If its pain lasts for more than half an hour, that's where you start thinking as heart attack and myocardial infarction. And if it is immediately not treated, the first 1 hour patients could develop into trouble, beating abnormality of heart, VT, and die. So this is the forms of, milder forms is angina, and once it becomes severe, it becomes heart attack.
Sir, somebody gets a heart attack. What is the window period, the safe period from where he should go to the hospital for help?
This is the most important, and I want all our viewers be appraised of about this important concept of the golden hour in the heart attack, right? So once we said arteries get blocked and he starts getting pain, human body is great. It still tries to tolerate and tries to get some blood from other parts of the body. But as it progresses more than an hour, then the heart starts getting into trouble, and after 6 hours or so, the heart muscle totally gets damaged. So why we have to know this is, if somebody starts developing pain, if we can go to a nearby hospital within half an hour to 1 hour, we can give medicines actually immediately to dissolve the clot. And if you go to facilities like Apollo or other places where you have facilities for cath lab, directly through a catheter, you can take inside and suck the clot out and make the blood supply to the heart totally normal within 1 hour. If you don't go, then heart gets damaged. Along with these medicines, you also give antiplatelet drugs and anti-cholesterol drugs called statins. All this, if patient goes in time, still you can keep the heart normal. And if you stretch it to further about 3 hours also, still heart gets damaged to some extent, but the best period is 1 hour. That's why don't wait too long. If you have any suspicion, if you have an aspirin or sorbitol tablet available, you could take it. It has some preventive benefits to prevent the further damage. But if you don't have them, don't wait longer. Rush to the nearest hospital and take treatment. But unfortunately in our country, in villages and periphery where these sort of facilities are not available, we have very good drug called tenecteplase, which can be given just IV injection like, and when it is injected in time again, first 2 hours after heart attack, that also dissolves the clot and prevents the damage happening to the heart. And then later the patient can come to higher places and to check for angiogram and if required angioplasty and stenting. This concept is called pharmaco-invasive strategy. So what I want all our listeners to know is, don't be worried even if you are not in a place where you don't have cath lab facility, but at least you should be aware to take aspirin and statin, and probably go to a doctor who can give this medicine to you, which can dissolve the clot, and then you can be shifted to higher centers for further management.
It's an amazing thing, sir. So whenever you have a chest pain, you should think about heart attack and you should consult a cardiologist. And once it is ascertained that it is a heart attack, so you should not miss the golden period. So within this golden period, if you go to a cardiologist, as sir has said, they will give an injection to dissolve that clot, or sometimes they do a procedure called primary angiogram angioplasty. Sir, can you just enlighten about that primary angioplasty?
Yeah, this is very important for all our viewers. As I said, these advanced treatments basically either through a small incision of 5 French in the hand or through a groin. We pass a thin wire first and then take the guide catheters inside and see where the arteries are occluded. As I have told, one on the right side and the 2 on the left side, if they are occluded and they clot inside, we have very good methods called micro catheter like thing. You take the catheter inside through the wire and then you can suck out the clot totally inside the blood vessels. And sometimes the residual cholesterol plaques remain inside, which might need balloon dilatation, as well as then to prevent the recollapse happening there, we put what is called as thin metallic tubes called stents. And previously when we were putting a bare metal stents, the stents were developing re-narrowing within it. So now we have advanced stents called drug eluting stents, where there is a drug coating over the metallic stent so as to prevent a re-narrowings happening. So that is why it is very important for a person to come on time. If he comes on time, then we have methods to suck the clot out and put that balloon dilatation and put the stents inside so that arteries blood flow becomes totally normal. One thing we should also realize apart from primary PCI is some medication which are to be taken before and after. That is basically we call antiplatelet drugs. Aspirin and clopidogrel were used before. Now we use ticagrelor and prasugrel which are more potent. And after that primary PCI is done also, the lifestyle change and the medication which are given by doctor and following that is very important, otherwise repeat clotting, repeat narrowings could happen. So but to a significant extent the science technology helps us to have a normal life even after heart attacks, provided you take some minimal precautions of diet and yoga, meditation and take those tablets on time, still you can lead a normal life.
In cases where people have heart failure, we have been listening that in heart failure the valves they doesn't function properly, and that is been picked up by a cardiologist and they send it to a cardiothoracic surgeon where they just open the heart and they repair the valve or they do a replacement. Sir, we just heard that you guys are doing a new technique, they call it TAVI, I heard. Can you just enlighten us on that new procedure, sir?
Yeah, this is a very good thing. Actually, a lot of advancements are happening in cardiology, especially interventional cardiology front. As you have told before, if the valves within the heart, either mitral valve or aortic valve, or tricuspid valve or pulmonary valve, there are 4 valves. If by infection or by aging or fibrosis, calcification, the valves get narrowed, then previously there were not many options. Chest was cut and the surgeon was actually removing those calcified valves and putting an artificial valve. But this cutting and all that includes lot of morbidity and sometimes patients were not doing well. So science has progressed. We ourselves in a country where the mitral valve inside used to get narrow, we were doing percutaneous balloon mitral valve water, PBMV. That is quite popular in our country. And we were actually having maximum experience because rheumatic heart disease was more common in our country. But the mitral valve, when it is leaking, only surgery was being done now. For that also we have methods called mitra clip procedures, and we also have TMVR, and we have also developing valves also which can be there just removed percutaneously and then replaced in place of valve without major cutting. That is about the mitral valve. But the aortic valve, which when a narrowing was there, when the dilatations were done, it was used to re-narrow again. So, but now we have a new technique which you mentioned as TAVI or TAVR, trans-aortic valve implantation or trans-aortic valve replacement. What it does is, this is an amazing procedure, especially it started when the patients were very elderly, sick, were not suitable for surgery. This was started first. What it does is through small 14 French catheter through groin, the valve is taken inside and then initially the calcium will be opened with a small balloon. Later through the valve will be taken there and the appropriate position it's inflated and then the balloon comes out, the valve remains inside. Previously they thought that the calcium could embolize and produce trouble, but all the safety precautions are followed and now this sort of procedure has become reality and we have done 100+ cases in Apollo and all the patients are doing well. And world across this procedure is picked up very well because there is less of morbidity. Today you do the procedure and patient can go home tomorrow. But the only issue is to which sort of patients we have to do it and whether the valve is suitable for doing this TAVR or TAVI.
Selection of patient.
Selection of the patient, that is important. It has to be done by a heart team concept where cardiologist, cardiac surgeon, imaging specialist, critical care doctor, all of us sit together and decide which patient should go for surgery, which patient can benefit by TAVR. So this sort of approach and doing what is right for the patient is very important and public have to realize which hospital follow this heart team approach and go to those places so that right things are done to the patient.
So it means that TAVI should be done by the right specialist and probably you go the right training for that?
Yeah, actually interventional cardiology is specialized so much that each of it evolves so much. So like the cardiologist and cardiac surgeons together you have a role to play in it. And predominantly because not much of cutting is involved, interventional cardiologists are involved more in the procedure, but we do take help and keep a surgical standby also. And as these technologies are relatively new, we actually had some training in Columbia University, and those Columbia colleagues like Sushil Kodale, others also came to our hospital, and then initially we started a program like that. Each of the hospitals have it, but this procedure has to be done by cardiologists who are trained in interventions.
Okay.
And like as you know, medicine is vast.
Right.
For viewers to know what sort of thing it is,
Yeah.
we would study for 6 years in undergraduation,
Amazing.
then
Yeah.
3 years in general medicine,
Yeah.
then 3 years in cardiology,
Yeah.
then 2 years after cardiology is interventional cardiology fellowship.
Yeah.
So maybe compared to others, 2 decades of your life is gone. But
Yeah.
it's a vast thing and it is an evolving field, and the right people have to do this job. That's how the patient gets the best. So as you said, training of interventional cardiology is mandatory. And actually this is a separate fellowships for this valve diseases called structural heart disease fellowships,
Okay.
which we just started in our country too,
Okay.
but they're very popular abroad.
Okay. So as we all know, Dr. Sreenivas Kumar, after MBBS, he has done his MD General Medicine, then he did his DM Cardiology, and then he went on doing interventional cardiology. Dr. Sreenivas Kumar also has a fellowship from American College of Cardiology.
Our Cardiological Society of India is actually called as CSI.
Okay.
All the cardiologists across the country, or over 4,000 plus, are part of it.
Okay.
But as you asked, some specialization happens in it, which we call as interventional cardiology,
Okay.
where we do procedures of dilating valves, putting stents, all that as we discussed.
Okay.
That division of cardiology is called as interventional cardiology.
Okay.
So to take care of this particular subset of activities, the society made one thing called a National Interventional Council.
Okay.
So I was fortunate to be chairing that for 2 years, and we did do a lot of interventional cardiology conferences called NIC.
Okay.
I was fortunate to also do that meeting at the place of alma mater, where I did my DM cardiology, Sanjay Gandhi Postgraduate Institute of Medical
Wow.
Sciences.
Okay.
And our Honorable Vice President Venkaiah Naidu came for it during
Oh,
inauguration.
great.
The beauty of that meeting is we could do a lot of these new procedures, workshops, and train younger doctors.
Okay.
And we also have exchange of cases.
Okay.
And people who from abroad, like Columbia University, New York, Germany,
Okay.
Italy, a lot of places also do live cases to gets transmitted to our country.
Okay.
So knowledge exchange and training exchange happens.
Okay.
And through our society also we try to do some workshops,
Okay.
and then where youngsters are trained.
Okay.
And now that COVID has come, still we have innovated new methods called, we call it as entertainment and education together.
Okay.
So as people are not accumulating at one big place, I did in 10 places across the country.
Wow.
And all these procedures were delayed live in PVR cinemas across the country.
Oh, really?
And it is called as edutainment, and there is a lot of appreciation for
Edutainment,
them.
yeah, new term.
And then these procedures and all, more doctors should learn,
Okay.
and so that more patients could benefit
Okay.
by this. So research is ongoing process, as you know.
Okay.
So a lot of new things are happening in interventional cardiology
Okay.
for the patient benefit. But finally, before we get into interventions, all of us should follow the healthy lifestyle Panchasutra is what I call,
Okay.
and so that you don't get into disease first. So if you are maintain your lifestyle well and sleep well, eat healthy and do yoga, meditation, walking, and then don't be stressful. If you are
Right.
honest, sincere, and don't take too much of stress, don't become habituated to habits like smoking and alcohol, then if at all, unfortunately, if you get into diabetes or blood pressure or cholesterol, if you take treatment,
Right.
if you follow all these 5 measures, which I call it as Panchasutra, the heart diseases and paralysis can decrease by 81%.
Okay.
So, but only thing, unfortunately, what is noticed is we tell a lot of things, but including doctors, maybe including me, we don't follow everything.
Right.
So if the people have investigated how much percentage is followed, only 1% of the population is following all these 5 healthy lifestyle measures.
Okay.
If this can increase, we can prevent the rising epidemic of coronary artery disease and strokes. And then 81%, God has given you opportunity not to get into this, provided we at least spend some half an hour time for keeping our heart healthy.
Okay.
So with this message of prevention, I thank you all once again for giving this opportunity.
Thank you, Dr. Sreenivas Kumar. Thank you so much for visiting our facility and talking to us. Let me tell you, Dr. Sreenivas Kumar is a consultant cardiologist. He is a director cardiology and clinical research at Apollo Hospitals. And Dr. Sreenivas Kumar was the first person to present a live case on TCT. They call it Trans Catheter Therapeutics. It's a world's biggest cardiology society in America, Dr. Sreenivas Kumar was the first person to present a live case from India, that is from Hyderabad to America. Sir did it, and it was not a very long ago, and sir continued to be a part of a member of that team, and his association with his colleagues in America brings lot of what you call technology to our country, innovation to our country, and he keeps training his young students and his colleagues. Sir, thank you so much for talking to our viewers, and thank you so much for sharing your knowledge with our viewers.